everybody, it's me on my own today. I've stolen Alex's YouTube channel to tell you guys about something that's going on in my life, which kind of by proxy means it's sort of going on in Alex's life, but you know. So a couple of months ago I was in bed, as you do, with no bra on, as you do, and thought I'd give myself a little bit of a check because it's not something that I do that often, because every time I've done it I haven't found anything. So it's kind of, I'm not entirely sure when I'd last done it before then, and I found something that hadn't been there previously. Basically I found a lump that was kind of in between, I guess, like the base fat layer and the skin, if you can kind of imagine what that means. Like I could definitely tell that it was something that I had not felt before. It definitely felt different and it felt abnormal, because for a really long time whenever someone said, oh, you know, you should check for this, you should check for that, I've always been like, well, how am I supposed to know what that actually feels like, because I've never felt it before. So I felt it, it was definitely different and it was definitely abnormal, and I slightly freaked out, just like a little bit. There's like quite a strong history of cancer in my family. There isn't a history of breast cancer, and realistically it's a history of breast cancer that means you're a lot more likely to have breast cancer. Like, a history of cancer does not make it more likely you will have breast cancer, if you know what I mean. I just freaked out because it's just that unknown, like when you don't know what something is, but you know that it could be bad, you just assume the worst case scenario. I'm clearly a little bit of a pessimist and was kind of like, oh my god, what is this? What's gonna happen? So then literally the next day I went to my GP and told her about the history of cancer in my family and the fact that I'd found a lump in my breast, and she took the top off and she felt it, and she, you know, she got me to tell her where it was, but as soon as she knew that it was not what was sort of normal. But her thoughts were that it was probably a cyst because of my age, and because I don't have a history of breast cancer in my family, she was sort of going, well, you know, it's most likely a cyst, it will probably go down on its own, give it 4 weeks. Basically, if I had been like even just a little bit older, I think she probably would have referred me in that appointment, but she didn't. She said, come back in 4 weeks if it was still there. And basically, if she had referred me in that appointment, it would have taken 6 weeks for me to get an appointment. If I wait 4 weeks and then she referred me then, it would have been an urgent referral, and so my appointment would be in 2 weeks, which means they both come up to 6 weeks. So it would have taken just as long, so it's kind of like, didn't really make any difference. I kind of spent the next 4 weeks poking it and being like, are you still there? And it was, and it's like mildly painful, like it feels a bit like sore, and I kind of probably didn't help that by poking it all the time. So I went back, and she didn't even get me to take my top off, she just referred me straight away because it was still there 4 weeks later. So a few days later I got a letter with an appointment in a week's time to go to the breast place. I don't even know what it's called. Breast clinic? Breast surgery? I don't know, breast clinic I think is probably the best terminology. So I went along, my uncle very lovingly drove me and Alex up to the hospital where it's at. I sat in a lovely waiting room full of lovely ladies and lots of pictures of flowers on the walls and some terrible old magazines that have been there for about 4 years. And then I went in to see my doctor. Your GP doesn't seem to necessarily pass on that much information. I guess the GP doesn't really know what it is they found. So I went in and I said that I found a lump, and the doctor that I was seeing there did a ultrasound. So it's basically like the same as if you're pregnant, like she put goo all over my boobs and then just like went up and down them with the ultrasound device thing. And she's found it straight away. Like I told her which breast it was on, and she kind of started at that point and was like, yeah, no, that is a benign tumour. And I was kind of like, well, benign is good, tumour not so good. So she checked everywhere, which was ridiculously tickly. Like literally, you're covered in slime and you've got this thing like rubbing up and down your boobs. It like, I couldn't stop laughing, which I don't think made her job particularly easy. And she then asked me whether or not I wanted to have a biopsy, which is basically where they take a sample and they send that away for testing. And I was kind of like, well, the worst that could happen from a biopsy is they find out it's not benign, so yes. So she gave me a local anaesthetic in the area where the lump is so that I wouldn't feel anything while she did the biopsy. That was kind of like, you know, it was a needle. I don't really have particularly issues with needles, I think they're fine. And then she did the biopsy, which was, I don't know if you've ever worked in a shop, but you know, like the guns you get for tagging things? For tagging clothes or shoes or whatever. Ka-chunk. Basically that is what I was like envisioning, because I didn't look while she did it. Basically she made a small incision and then through that incision put in this thing which took a sample, took it out, and then took another sample and another sample. But every time, like, because I was just staring at the ceiling and like wildly above my head, and all I could visualise was one of those guns that you use for tagging stuff in a shop. So I don't know exactly what they used or what they did, but that was the visuals that I was getting. Because you can't feel anything, it's just like you can feel that something's happening but you can't feel any pain. So you can feel like someone is poking around, and you hear the noise when it kind of takes the sample, but it's not painful. So after that, the doctor left and the nurse put some cotton wool over the incision that they'd made and basically stood there for like a whole minute just holding this cotton wool against the incision because it goes quite deep and I think it bleeds quite a lot, and she just held it there. She was like, I just got to put as much pressure on it as possible. So after that she basically put a massive wad of like cotton, like the thick, not like cotton pad, and then like basically a sheet of sticky back plastic held that on. So it was like my whole boob was being, because I was lying down, it like held my boob in a particular position, and then as soon as I stood up, all the sticky back plastic just like wrinkled as my boob reshifted into its normal position. So that was a bit bizarre. Put my bra back on, went for a cup of tea with my aunt and uncle and with Alex. And I kind of felt fine at the time, but then slowly as the evening wore on, my boob started to hurt more and more, and eventually I had a look at it and there was a bruise that just went across the entirety, like literally the biggest bruise I've ever seen in my life. I was quite impressed, to be honest, that my body was kind of so multicoloured. They said that the results would probably take about a week, but this was like around Christmas, so I was kind of sceptical as to whether or not they were going to get back to me, because I figured, you know, people will be on Christmas holiday, stuff gets left behind, bank holidays, blah 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 blah. But no, I got a phone call from my doctor at 6 o'clock at night as I was walking home from work to tell me that the results had come back and that it wasn't cancer, but that they wanted to remove the tumour as soon as possible. To be completely honest, that was a bit of a surprise, because I kind of figured it was going to be one of two options. Option number one, A-OK, on your way. Option number two, it's cancer and we're going to do something about it. I kind of got option number three, which was, it's okay, but we're going to do something about it. I mean, it's kind of nice. I guess it's better than it just growing and growing and growing and then becoming a problem. And I guess there are chances that even benign tumours can go a little bit wayward if they're left to their own devices. So, you know, getting it out now, while it is definitely okay, is obviously preferable to getting it out when it's become an issue. Before I found this lump, I found it really hard to visualise what a lump would be like. And I think the thing that you need to think about is that you need to trust yourself. So if you are checking yourself regularly, or at least, you know, relatively consistently, you will notice if something is different. If you don't know what you're looking for, it can be quite hard to actually keep on top of checking, because you kind of don't think it's important and you're kind of like, well, I wouldn't know what, you know, if I felt it, how would I know that it was it? But it's just about familiarity with your body and knowing that you know what is normal for you and you know what is different. I have now found a lump that is not consistent with my normal lumpiness. That is an issue. So we're going to keep you updated with how it goes. We're going to possibly film the trip there. And sorry that we don't film as often as we should do. We've had a very busy year. We've tried so hard, and life just gets in the way. So yeah, I just wanted to send my love out to everyone who watches our videos, and I hope you still enjoy them and carry on enjoying them, because we enjoy making them. So see you soon.